TBS Dental, Instruments Maintenance and Care Guide, 3-Step Simple Cleaning. Note: wash all new instruments with warm soapy solution prior to first sterilization cycle. Step 1. Pre-cleaning. All instruments must be thoroughly cleaned with enzymatic detergent or tap water to remove visible blood, protein, and other debris from surface, joints, serrations, and any other crevices prior to cleaning. Step 2. Manual or mechanical cleaning. You can clean or disinfect your instruments using a manual or mechanical method. For manual reprocessing, the instrument should be placed in an OSHA-approved enzymatic detergent or disinfectant. It is extremely important to have the correct concentration, exposure, and temperature specified by the manufacturer of the detergent or solution. Do not mix tartar and stain remover with enzymatic detergent or ultrasonic solution. All hinged instruments must be in an open position in the soak bath. We recommend using only nylon or plastic brushes when cleaning your instruments in the soak bath. Clean detergent solutions must be used for each cleaning session to prevent any cross-contamination. The other cleaning method is using an ultrasonic bath. We highly recommend ultrasonic cleaning since it is great at cleaning microscopic particles that are protected by the texture of a surface or designed features like hinges and cannot be cleaned by manual processing. Ultrasonic cleaning should not exceed 15 minutes. Ultrasonic cleaning is not recommended for scissors, needle holders with tungsten carbide inserts, other sharp or delicate instruments. Nor is it recommended for instruments that are not 100% steel, like mouth mirrors, rubber, titanium, tungsten carbide inserts, or diamond-dusted tips. The ultrasonic vibrations can chip, break, or corrode welded parts. We recommend changing ultrasonic solution every day when it comes to cleaning surgical instruments. This ensures that the potential for cross-contamination of instruments and instrument sets is reduced to a minimum. Following ultrasonic cleaning, rinse instruments with distilled water. Avoid rinsing your instruments with regular tap water as it has minerals and high concentration of chloride, which can result in pitting corrosion or spots on your instruments. Once instruments are rinsed, make sure to completely dry them before moving to the next step. Step 3. Sterilization. To retain the value of the instruments, it is very important that they are completely dried prior to sterilization, as residual humidity can cause corrosion damage. Sterilization is performed most commonly with saturated steam, usually at 134 degrees Celsius. Never exceed temperatures 350 degrees Fahrenheit or 177 degrees Celsius, as this will harm the hardness of the steel. Only use fully demineralized or distilled water in the autoclave or sterilizer. The use of tap water will result in deposits and corrosion on the instruments and the sterilizer. All stainless steel instruments should be placed in separate sterilization pouches and not with any carbide instruments during instrument processing. All hinged must be autoclaved in an open position.